Hey guys, what's up? It's Cheryl Dunn from CORE Therapy and Pilates in Austin, Texas. And today I wanted to just go over a quick question that I get in the clinic frequently. When we get into movement and exercise with our clients and we start to work on their postural muscles, their core muscles and whatnot, one of the common things that we find is that people's ribs will flare out and they'll pop out like this. We notice it when they're standing and we go through the postural assessment. I bring it up and we talk about it with clients. And when people lay on the table, it's very noticeable and easy to see and whatnot. But what we really see is when people start exercising and moving is that they really pop up, and folks have a real hard time of connecting to the ribs and bringing the ribs down. So with that said, what I want to do today is I want to go over just a little bit of a explanation of that, of why are the ribs popping. And so what I'm going to do is I'm going to bring my man Fred here into the mix, a skeleton, and let me get these out of the way. So what happens is there's the muscle that's underneath the ribs is called the diaphragm, and it goes in a scenario, it goes into a position like this, where it's kind of like a tent, and it's going like this, or a dome, right across there. Now what happens is when the diaphragm gets imbalanced, it gets tight, people start breathing improperly, and they start using what we call the accessory muscles up here, and actually not the diaphragm for proper breathing. And as that starts happening, it starts lifting everything up here and bringing those ribs up. What we also see through this process is the low back, the lumbar spine sways a lot, and as the lumbar spine right through here sways, that's a part of those ribs popping out as well. And then what's going to be a contributor with this, what's going to be a contributor with that happening is the psoas is going to be tight, and the hip flexors. So that's going to be the muscle sitting right here, represented by this green band. Can y'all see that? Yeah. And so that green band is the psoas, and when it gets tight and pulls you forward, you end up in this scenario where the lordosis, or the lumbar curve, is excessive or arched. So with that, we end up with a swayback. We end up with the ribs popping, and that's a common posture that we see our clients present with. So with that said, we have a program that's designed to release the hip flexor, to release the diaphragm, and then actually strengthen those guys, strengthen the core around it, to actually create an awareness from your brain to those muscles to be able to use them properly, so that, so the back's not so swayed and the ribs aren't popping. So that's the answer to why are my ribs popping. It's an imbalance of the hip flexors and the diaphragm, and with that said, it leads to, or it causes many breathing problems. It causes this to happen, which is what we see all the time. So I hope that helps. Again, it's a common question I get in the clinic: why are my ribs popping? And that's my answer. I hope that makes sense. Y'all take care. Have a fantastic day and a fantastic week, and we'll see y'all on the flip side. Take care.